These days, you are seeing a trend of old legacy companies trying to become transformers. They're not just increasing their IT budget, they're trying to become digital in the traditional sense. And today we've seen an acquisition where Mylab has acquired the startup Sanskritech. We're now being joined by Hasmukh Rawal, the managing director at Mylab, as well as Pritam Kumawat, the founder of Sanskritech. Gentlemen, welcome to Startup Central. Thanks so much for joining us. Hasmukh, you're the buyer, so I'll come to you first. Why is Mylab acquiring Sanskritech? Is it indeed to become a transformer, a bigger phygital play, a bigger digital play?
So it's of course a strategic move with the intention that Mylab want to bring the affordable healthcare across the different regions of the country, and with point of care systems, it would be very easy. We have seen that in COVID as well, when decentralizing testing help you in increasing the access and turnaround time, and that would be the real game changer in coming times.
Okay, so that's the reason why you've gone in, and you're calling this, of course, to be strategic. Pritam, why did you sell out to Mylab? How involved are you going to be?
First of all, thank you very much for having me here. And more than a sellout, like we term it, it's like a matching our synergies and vision. Yes, the majority stake is going to be with the Mylab, but the operations will continue as it is, and we all promoters and the existing team will also continue. And the objective is to achieve, enhance the technology with the help of technology and Mylab's already existing portfolio, and we are going to work jointly to develop and make the point of care testing available across India at affordable cost.
So, Hasmukh, if you look at Sanskritech, it of course developed Swayam, which is, to take care of point of testing care. 70 such they have. What is a strategic play? What do you hope to do?
So number one, of course, we want to add the parameters on the current platform so that it covers almost 80 to 90% of routine doctors' healthcare checkup requirement. Most of this test you need to wait for 2 or 3 days today as well to have these reports in hand with you, and which we want to bring it right at your doorstep. So covering more and more of platform parameters is first key for us, and to do this, adding platforms, adding reagent capabilities, adding instrumentation capabilities is what Mylab would be adding on this.
The idea, I believe, is also to establish more than 1,000 point of care systems. Now, what I would also like to ask you, Pritam, is that your business is basically also seen as a way of having a portable diagnostics lab. Tell us more about it. Obviously COVID-19 has made health tech a hot space. You are seeing a race for health tech, biotech companies to become platforms. So tell us this, how do you set up these portable diagnostic labs?
See, the idea is like in India, right now we have everything, technology as well as the best experts, but the access to basic healthcare is a still majority issue for majority of Indians. And in COVID, things have been, highlighted very much. So the idea is to create a platform where people can do instant screening, not only for the COVID, but there are many other important parameters which are very essential. And we intend to reduce the delay in diagnosis, which can actually help to improve the health of people, as well as its government's mission also to have a Swasth India. So this is why we have joined the hands together.
Okay, and Hasmukh, are you going to tell us how much does acquisition cost?
Yeah, it would be very early to comment on this because there are few of the nitty-gritties of the transaction are still yet to happen. So maybe in a week or so we would declare that. But definitely, it's rather than a cost, it's an investment for Mylab.
Okay, you're calling it an investment. Is this the first of many that's going to come for this platform play?
So this would be a second transaction. This would be a first, and there's one more transaction we are working on point of care imaging systems, where we would be able to do imaging based diagnostic easily. So at the end, we want to integrate all of this in a single platform. So that would be the ultimate plan with Mylab.
But Hasmukh, what is the final plan? You'll have diagnostics, you'll have testing, but now if you look at a Bajaj, for example, is also looking at a healthcare platform, right? Which will even have insurance. You've got PharmEasy, which is working on its platform, which is going to have forward integration and the full gambit. So, what all is your platform going to have?
So first of all, the platform here is going to do more and more testing. Along with that, it also has a telemedicine capabilities. Right now, we will not be focusing on those. But ultimately, if you want to do a telemedicine or you want to launch a healthcare solution without a diagnostic as a beginning, hardcore diagnostic, it won't be the real successful solution. Mylab being the core innovator with cutting edge research around kits, machineries, sensors and diagnostic solutions, I think we have a added advantage to make this testing affordable. Our aim would be to partner with whether it is Bajaj, whether it is PharmEasy, to partner all of these guys and give them the hardware and reagent capabilities to serve what they intend to do.
Pritam, are you going to stay on in the company after this acquisition, or do you have the itch to start something new? Timing is, of course, worked out really well, because for anybody in health tech, thanks to the pandemic.
No, all the promoters are going to continue. It's not an exit for any one of us. In fact, we are going to work jointly for the further development and make this mission successful. In fact.
Okay. With that, gentlemen, I'd like to thank both of you for joining us here on Startup Central. Health tech is clearly been a winner of COVID-19. You're seeing a platform play that's taking place. Mylab here now making this M&A. Another one is in the works. Its platform play is going to be primarily for diagnostics. It's not bundling up too much and looking at telemedicine for now.
Thank you so much. Thank you.